Have you ever swallowed a pill without knowing it could quietly raise your chances of dementia? This is a tough truth that many older adults don't hear enough about. Several medicines commonly prescribed to seniors can heighten dementia risk. These aren't rare or unusual drugs. They're everyday pills millions take, often without noticing the hidden dangers. If you are past 60, this message is especially important. Being aware of which medicines to be cautious with could help safeguard your memory and your independence. In this discussion, we'll cover 4 groups of pills that neurologists say may play a role in memory decline and dementia in seniors. This isn't about spreading fear. It's about sharing facts based on studies and medical experience. You'll discover how these drugs affect the brain, why they're given so often despite the risks, and what other options or conversations you might have with your doctor to stay safe. Stay with me through the end, because not only will you understand which medicines to look out for, but you'll also hear practical ways to talk with your healthcare provider and protect your brain for the future. This is about knowledge and empowerment, not panic, helping you live longer, wiser, and with peace of mind. Number 1. Anticholinergic medications. Among drugs tied to dementia in older people, this group stands out as both common and concerning. These medicines are prescribed for allergies, bladder troubles, insomnia, and certain stomach problems. At first, they seem harmless since they ease symptoms like a runny nose, restless bladder, or sleepless nights. Yet, they work by blocking a brain chemical called acetylcholine, which is essential for memory, learning, and mental function. When acetylcholine is blocked, even for a short time, it may cause forgetfulness, confusion, or poor focus. For younger adults, this might only be a mild issue. But in older people, especially those already vulnerable, long-term use has been linked to faster decline in memory and greater dementia risk. What makes this more alarming is that many seniors take multiple medications with anticholinergic effects without realizing it, unknowingly increasing the impact. Consider Eleanor, a 74-year-old woman from Ohio, who struggled with allergies and frequent nighttime bathroom visits. She was prescribed an antihistamine and a bladder drug, both with anticholinergic properties. Over time, she became forgetful and easily puzzled, thinking it was simply aging. Later, with a pharmacist's review, she learned the medicines might be causing her problems. After her doctor adjusted the prescriptions, her alertness and clarity improved. The issue is that anticholinergics appear not only in prescriptions, but also in common over-the-counter remedies for colds, allergies, and sleep. Many assume that if it's sold without a prescription, it must be safe, but that's not always so, especially after 60 or 70. Over months and years, the buildup can gradually harm brain health. That's why it's vital to regularly review medications with a professional who knows these risks. Ask questions like, does this pill affect my memory? Or is there a safer option? The right guidance can help you get relief without sacrificing your mind. This isn't about stopping needed treatment. It's about wise choices. Sometimes a different medicine, smaller dose, or even non-drug method can provide the same help without hurting your brain. Knowledge is your strongest shield. Understanding the role of anticholinergics is the first step to protecting your mind as you age. Many older adults fall into this trap, but with awareness and proper advice, you can avoid it and keep your mind sharp for years. Number 2. Sleep aids and sedatives. Another group doctors often warn about is sleep medicines and sedatives, including benzodiazepines. These are commonly prescribed for insomnia, restlessness, or anxiety, problems that increase with age. While they can bring relief and hours of rest, long-term use carries serious costs for brain health. Sleep aids calm the central nervous system, slowing brain activity to promote relaxation or sleep. But over time, this disrupts the brain's natural rhythms that protect memory and mood. Long-term use has been tied to confusion, memory loss, and higher dementia risk. Take Henry, a 78-year-old retired accountant from New York. His doctor gave him a benzodiazepine for his sleep struggles. At first, it worked well, but after months, Henry noticed forgetfulness, poor focus, and disorientation. Worried, his family encouraged him to see his doctor. Together they reduced the dose and explored non-drug sleep solutions. Eventually, his clarity and daytime energy improved. The problem is that these drugs are widely used in senior care because sleep problems harm quality of life, and the pills give quick relief. Yet the long-term dangers are often overlooked, even though safer methods like sleep therapy or better sleep routines exist. Older adults also process these drugs more slowly, meaning they stay in the body longer, raising risks of dizziness and falls, which add to the danger. The cycle of physical harm and mental decline can become serious. If you or someone you care for uses sleep aids often, it's crucial to openly discuss it with a healthcare provider. Ask about the risks, look into alternatives, and make a plan to limit drug use while still getting rest. Sometimes small lifestyle changes, less screen time before bed, meal adjustments, or relaxation practices make a big difference. The lesson is that while sleep aids bring short-term comfort, they may hide long-term dangers for older people. Protecting brain health means balancing today's relief with tomorrow's well-being. Exploring safer paths to rest is vital. Knowing these risks helps you make smarter choices about sleep and medication, keeping both your nights and days full of clear thoughts and memories. Number 3. Certain antidepressants. Medicines for depression often affect the brain, and some types can raise dementia risk in seniors. Older antidepressants, especially tricyclics, have been tied to cognitive decline when used long-term. These drugs change levels of brain chemicals like serotonin and norepinephrine, improving mood, but sometimes causing confusion, forgetfulness, and slower thinking. These side effects may look like natural aging or early dementia, but they could actually come from the medicine itself. Linda, a 69-year-old retired nurse from Colorado, was prescribed a tricyclic antidepressant after losing her husband. Over the next years, her memory and focus worsened. With her new doctor's review, she discovered the medication might be the cause. She switched to a newer antidepressant with fewer cognitive side effects, and her clarity improved. Many seniors are still prescribed older drugs because they're effective and cheaper, but their risks to brain health should be carefully considered, especially if dementia is already a concern. Stopping or switching antidepressants should never be done alone. It requires a doctor's guidance. Every person's mental health path is unique, and the goal is always to balance emotional well-being with mental sharpness. If you or someone you know is on older antidepressants, ask the doctor about brain side effects and whether other options are safer. Being informed allows you to choose care that protects both mood and memory. The link between antidepressants and dementia is complex, but awareness gives you power. It's about balancing emotional healing with cognitive strength, both of which matter for living fully. Number 4. Over-the-counter PM pain relievers. Many older people take nighttime pain relievers to ease aches and sleep better. These usually include diphenhydramine or other sedating antihistamines, which strongly affect brain function when used often. They may seem harmless since no prescription is required, but they can quietly lead to memory problems, confusion, and higher dementia risk in seniors. These drugs work by depressing the nervous system, causing drowsiness and sleep, much like prescription sedatives. But long-term use can reduce mental clarity. Because they're easy to buy, many seniors rely on them without realizing the risks. Joe, a 75-year-old retired mechanic from Indiana, used PM pain relievers for arthritis pain and occasional sleeplessness. Over time, his family saw he was forgetful, missing appointments, and even getting lost. His doctor later linked the issue to his regular use of diphenhydramine-based pain relievers. With proper guidance, he tapered off and found safer alternatives, regaining mental sharpness. The challenge is that these drugs are often taken unsupervised, since they're sold freely. People believe they're safe for daily use, but for aging brains, that's not true. Over time, they can mimic aging symptoms, while actually being drug side effects. Seniors and caregivers should always read labels, ask pharmacists about contents, and look for safer options. If you use these drugs often, talk to your doctor about better pain management, physical therapy, gentle activity, or heat therapy. Protecting brain health isn't only about prescriptions. Even over-the-counter medicines can cause harm. Being careful with what you take is one of the strongest ways to preserve mental clarity as you grow older. Final thoughts. We've looked at 4 categories of medicines: anticholinergics, sleep aids, certain antidepressants, and nighttime pain relievers. Each can affect memory, thinking, and brain health in ways many seniors don't expect. Recognizing these risks isn't about fear, but about awareness and wise decisions. If you or someone you love uses these medicines, the most important step is to talk openly with your doctor. Ask about side effects, discuss safer alternatives, and review your medication plan together. Your health, your memory, and your quality of life are worth protecting. None of this means stopping needed medicine suddenly. Doctors can often find safer balances. You deserve to feel well emotionally and mentally, and with the right guidance, both are possible. Reflect on what you've learned today, and consider how you'll apply it. Awareness and open conversations with healthcare professionals can make all the difference in protecting your brain and enjoying life with clarity and confidence.